If your child is getting recurrent croup symptoms every time they get a cold, this video is for you. Keep watching. Many kids, especially toddlers and preschoolers, especially kids in daycare, every time they seemingly get a mild cold or virus, they develop high-pitched barky croup symptoms, especially in the middle of the night. Many families who have been responding to my croup videos have been pointing this out, and it's something we see in the office all the time, this recurrent croup pattern. The main point of this video is that parents should be proactive about asking about how to manage this. It's not considered something you just simply watch and observe most of the time, especially if it's happening more than 3 times in a viral season, or the symptoms are severe and sending you to the ER. The first is that normally your child has a picture of their neck, a soft tissue neck x-ray. Here's a great example of a soft tissue neck x-ray. Notice the steeple sign showing the narrowing and the swelling caused by the virus that is causing the restriction in the size of the airway that leads to the very distinctive cough. If there's no other abnormality, most kids are then offered a course of inhaled steroids. Inhaled steroids are medicine that you breathe using a spacer and a puffer. They coat the airway and they block the recurrent inflammation that's triggered by routine cold viruses, so it significantly decreases the frequency and severity of symptoms. If for most kids that's all you have to do, and then as they get bigger and older, the symptoms get better on their own and we stop having to use the medicine. For kids who either have persistent symptoms that do not respond to the daily inhaled treatment, or their symptoms are particularly severe, or they have an abnormality on their x-ray, the next step is to be referred to an ear, nose, and throat specialist to have their airway directly evaluated with using usually a camera. But the point of this is that it shouldn't be considered normal that your child is just given steroids 4, 5, 6 times a year for recurrent croup symptoms that are triggered by every time they get a cold. You should be asking your pediatrician about what to do next. If you have any questions about this specifically, put them in the comments and I'll try to get to as many as I can.